across the world, different ways to lead,
Different voices giving what you need.
different angles, different views, all bringing something you can use.
From every corner, hear the call. Level up now, give it your all.
Mind, body, business, elevate, new perspective, shift your state. This is Coaching Call.
With Sifu Rafael. Sifu Rafael.
Sifu.
Rafael.
Different paths, different minds, take what works, leave what doesn't align. Every voice brings something new, now the choice is up to you. Take the insight, make it real, turn the vision into skill.
From every corner, hear the call.
Step into it.
Stand up tall. From every corner, hear the call.
Step into it.
Stand up tall. Coaching Call with Sifu Rafael. Sifu Rafael.
Kevin, my gosh, what a pleasure. Thank you so much for being on Coaching Call. How are you today?
I'm doing very well. Thank you very much. Good to be here.
Yeah, absolutely. So I am super excited to have you on the show. I know we had you on Unified Leadership, but this particular show, what I love to do is get to know you more, right? And I know we have a transformation, healthcare, and everything that you're doing for it, but I want to get to know you first, right? So tell me, where were you born, and who would you say influenced you before even the age of 10?
That's a really good point. I was born in a little town called Gothenburg, Nebraska, which is right on the Platte River, out in western Nebraska. And my great-grandfather was a draft dodger from the armies of Germany back in the day. And he got on a boat, came over to the United States, and they said, well, you got to get on a train and you go to where the train stops and you get off. And that's where he homesteaded. And that was north of Gothenburg, Nebraska.
Oh, wow.
And that's where I was born. And less than 10 years of age, that's important, because probably one of the most important seminal experiences in retrospect. I mean, this sort of came to me maybe, I don't know, 6-7 years ago. Back when I was like 8 years old, 7 years old, one of the things that we did is that the whole community would come together we were farmers, would come together, relatives, friends, neighbors, etc., to do harvest. Everybody helped each other. And I'll never forget this day of harvest, because what happened is I had a job, even though I was 7 years old. And my job was to stand in the combine and push the grain into the corners. I mean, not a big job, with my little shovel, but I had a job, and everybody had one. So as we were out there was this thin black line that occurred on the horizon. And over the course of the next couple of hours, that thin black line became a massive, big, huge, massive black line, to the point where at one point my uncle said, "Oh, we got to go in." And so we scrambled. We went down to the barn. We got into the barn, and as we were getting ready to walk across from the barn to the house, all of a sudden these little pebbles of ice started to fall. And they're falling. And by the time we got to the house, which was, maybe 50, 60 yards away, they were like golf ball size. I mean, it was a huge ice storm. And as we stood there on the porch, I'll never forget this. This is the important part. I was standing there holding my dad's hand. And it's silence, total silence. There's some crying going on in the background, but total silence. And then the storm stopped. And as we looked out, the entire wheat field was totally flat. And I'll never forget what Dad said. He said, "Well, I guess we should get on with the rest of our life." That's persistence. That was my first lesson in persistence.
Yeah.
I'll never forget it. As a matter of fact, I get a little teary thinking about it.
Of course, of course. And you mentioned that there was some crying in the background. Crying was probably from someone who realized that
Yeah.
that was a defining moment.
Yeah, that was I think it was, I'm not for sure, but I'm pretty sure it was my mom and my aunt and, a couple of neighbors. Because, it is a defining moment. Because as a result of that, Sifu, we lost the farm. And
Right.
we moved into town, and my dad ended up doing all sorts of other stuff, with his career. So it was quite the experience. Quite the experience.
Yeah, that's interesting. So you saw your dad not only understand that he accepted what he had no control of.
Right.
And most people have trouble accepting what they have no control of.
Right.
So your dad did it in an instant,
That's right.
and he announced it.
Well, we should get on with the rest of our life. That's right.
That's powerful.
It is powerful. And something that I'm reminded of it on a regular basis, over the course of my career when I've run into those kind of problems that just seem insurmountable and where I can't solve it. It's like, well, I guess I should get on and, try a different track, try a different way, solve the problem.
So you saw your dad move on. You said you guys lost the farm.
Yep.
That was a struggle. What did you see? What did you feel? What did you notice?
Well, very shortly after that, we moved to Gothenburg, where I was born, and my dad started, delivering propane gas for the local gas company. But then he ended up, he was a very religious man. He was very active in the Lutheran Church, and the local minister got him involved in helping at the nursing home. And so he ended up basically becoming the assistant administrator at the nursing home. And over the course of his career, then he became a nursing home administrator. And he ended up starting nursing homes for the Lutheran Church all over the Midwest. So that was his, claim to fame. And so he made something out of the fact that we lost the farm.
He did not let that stop him.
No. He was a very quiet, resolute kind of guy, So, yeah.
Is that from him going from being a farmer to doing nursing homes and claiming his fame, if you will, in that realm? Is that what motivated you to go into the healthcare?
Well, actually, there's a story there too.
Let's hear that one.
We got lots of stories here. So I had declared that I was going to become a brain surgeon when I was a little kid. I was in the second grade or something like that. And so I had talked about this over the years. But when I got to, I also, when I was in the sixth grade, got involved in theater. And I had the lead part. I was the man in the moon. And so in this little local play that we had. And as a result, I really enjoyed theater quite a bit. And in high school, we ended up taking the play where I had the lead to state. And we won state. And this is, now we had moved to North Dakota. So I was living up in North Dakota. And we took state. And so that was really great. And in fact, I got a full scholarship to one of the state colleges for theater. And one day I came home And my mom, who was a very significant force in my life, I guess is the right words, said, "Kevin, we need to talk." I said, "Oh, okay, Mom, what do you want to talk about?" She said, "Sit down." I said, "Okay." So I sat down at the kitchen table. She said, "I know that you think that this theater thing is exciting and it's a lot of fun, and you really enjoy it a lot, but you know what? No one's ever going to come see you." I said, "What do you mean they're not going to come see me?" She said, "No, they're not. I mean, you just don't have it in you. You should be going to medicine like you've always talked about." I said, "Oh, okay, Mom. If that's what you think I should do." So I studied hard and ended up getting into medical school, and for a variety of reasons, and the rest is history. So, and then I got into not just being a practitioner, which I really enjoyed, but I was a family physician, took care of lots of families. But I also got involved in sort of management, if you will, which is where I sort of made my mark in the field of healthcare.
When you did start your journey into medicine, did you know you wanted because initially you wanted to be a brain surgeon in second grade, then you changed along the way, right?
Right.
So when you got into your studies, what was attractive to you? Because what is sometimes attractive is not practical. What's practical is not always what winds up being. So what was attractive to you when you first got into even medical school?
Well, I think the core issue that was attractive to me is that I was able, as a result of practicing and also preparing myself for practicing, to make a difference in the lives of people and to help them in ways. And I found that very satisfying. And in some ways, that sort of whole way of thinking was part of my career in management as well. I got real satisfaction out of going into an organization that had particular issues or problems or whatever, and helping to solve those problems and to make a difference and to make healthcare better, whether it was at the macro level or at the micro level, one-on-one with an individual. And I think that was really the core of what I've enjoyed about my career. I actually got involved in leadership issues as a medical student. I was elected president of the American Medical Student Association, which is the association of medical students, when I was a junior. And they required that you take a year off. So I took a year off, and my very first activity a week after I was elected was to go to the Council of Deans, which is all the deans of all the medical schools in the country, and give a talk about what was wrong with medical school.
Right.
So
how well did that go over?
well, it went over. I mean, I put it in a positive way about, these are the things we need to be including as part of our curriculum and our training. So it was a good experience. Yeah.
It's very interesting that in order to be part of it, you had to take a year off.
Oh, yeah.
Taking a year off was not really taking a year off, was it?
No, not at all.
It was a learning experience.
Oh, total learning experience. During the course of that year, I testified before Congress to support the National Health Service Corps. I got very involved in working on a bipartisan basis with lots of different legislators at the national level. I met with deans. I visited, I think it was 43 medical schools to talk with the students about how important it was for students to get engaged and, not just the practice of medicine, but the practice of healthcare, and so that was my message, even back then. So
So, Kevin, you took that year off. That really taught you a lot.
oh yeah,
But did you lose time, if you will, because you were not studying to be in your profession? You were doing something different. You were kind of working for that year.
I was, but I was really augmenting for my career. I guess in many ways I've sort of gravitated towards leadership roles in the field of healthcare over the years, and it was a result of that sort of initial experience, um, with a really deep understanding, if you will, of what it means to be engaged in taking care of people and to be one-on-one with the patient. For example, there's a big debate now about artificial intelligence and machine learning and the impact that that's going to have on the profession. And I do think there's going to be a huge, massive impact. But at the same time, I will tell you that when I reach across the table or the wheelchair or whatever and touch somebody, that's a very powerful thing to do. And I don't think computers can do that. I don't think artificial intelligence, I don't think robots can do that. You know, maybe some days they will. Someday it'll happen. But at least in my lifetime, I don't think it's going to happen. And so there's still a role for us humans reaching out to one another. And I think that's part of maybe the lesson that I learned as a result of all those experiences.
And I think that you're 1,000% right. And I don't think it'll ever happen, even a million years from now, because robots, they will not have a heart.
That's right.
That's the one missing piece.
That's right.
They may be a computer up here like we have, right? Because we have an incredible computer.
Yeah.
But the one thing that they're doing is they're trying to make them more intelligent, more able to do things. Now they have all these things coming out where they're having it look like a human and so forth. But the one thing they will never have is a heart. And why would they even spend any money on technology to give a robot a heart? A robot doesn't need a heart.
Mm-hmm. That's right.
That's the one thing I believe that they will never be able to duplicate.
Yeah, I think you're right. I think you're absolutely right. So there's always going to be a role for people-to-people interaction, and support. So
Yeah, there's that warmth, right?
that's
Because a
right.
robot cannot, I mean, it could play the part of if you program it to have a heart, be compassionate, it could do that,
Right.
but it's not genuine. It's because it was pre-written.
That's right.
There's not at the moment of, oh, I feel for you, really, from my heart, because it can't say that.
Right. That's right. Absolutely.
So when you went back to your studies in medical school,
Mhm.
what was your pursuit at that point? You went through this whole year
Yeah.
of understanding the concept of even talking to all these deans about what's wrong with medical schools, which I love that, to now going back to your own studies.
Yeah.
Do you think that year helped the industry as well?
Oh, did I help the industry? Um,
In that year of telling them what they could do better?
yeah, I do think so. I mean, one of the issues that we were involved in as medical students is that we were very concerned about how the drug companies were using prisoners for drug testing
Mm.
and whether that was appropriate or not. So we were very much against that. And so I visited like 10 or 12 CEOs of the major pharmaceutical companies in the country on that topic and advocated that they needed to change their ways and etc. We also were involved in AMSA in developing an initiative to educate clinicians on how to be members of teams, because our feeling was that to be effective in delivery of care, it wasn't about you, the individual, it was about you in association with the team of people that you had around you. And it was the team that really made a difference. But to be an active member of a team and a participant in a team and to understand the dynamics of a team, you had to have a different framework. So that was part of what we did as well. So it was a very exciting year, actually. And I brought all of that kind of thinking back to my senior year at medical school, where I was going into family medicine. And then I ended up matching at the residency program in social medicine in New York City, which was my great escape from North Dakota to go to the Bronx. And it was social medicine was a very interesting program. I'll never forget the very first thing I had to do. We showed up for orientation, and the very first activity I had to do was go out and apply for food stamps.
Really?
Yeah. Isn't that that's an interesting experience to have as a young physician?
So as a physician, you had to apply for food stamps.
Right.
Now, here's my question. Did you receive food stamps?
No, I didn't, because it was the process of application that I had to go through. I had to get all this data put together and all this stuff. But then once I got everything put together, it was like, okay, you can stop now. Now you know what it's like.
Mm-hmm.
So
it's not so easy, is it?
No, it wasn't easy at all. It wasn't easy. It required several visits.
But we complained that people are on food stamps.
Yeah, it's crazy. I'm very upset with what's going on right now, where we're taking resources away from those who are barely making it, and it's just really a sad situation. Frankly, we probably don't want to go there. No, but I agree with you, because we can't help those people who are in our country, but we send out millions, if not billions, to other countries to help them. Yeah.
But we can't help our own.
Well, but even the billions we send out to other countries has been cut recently. So we're taking all of our investments and putting them in, I think, the wrong areas. Totally.
Correct.
And we're also making it possible for people to keep their billions of dollars and multi-millions of dollars versus, having a reasonable, at least what I perceive, because I've done well in life, a reasonable tax structure, So,
yeah.
Anyway.
You're right, because why should somebody who makes $1 billion not pay as much tax as somebody who makes 100,000?
That's right.
In comparison, right?
Mm-hmm.
So you went to be a family physician.
That's right.
How long did that last?
Well, I actually went from the Bronx back to North Dakota to practice, and I taught at the medical school, and I started a program called the Center for Rural Health, which over the years has become one of the premier programs in the country related to solving problems of healthcare delivery in rural areas. And as part of that, I practiced family medicine at the local clinic, and I delivered lots of babies, which was really fun. In fact, I still have some patients that I worked with that still stay in touch with me. So
that's incredible.
Yeah, it was fun.
But as a family physician,
yeah,
you delivered babies. You don't hear that much, right?
Yeah, you don't hear that as much anymore, although you do in the rural areas, but not so much in the urban areas, because we've parsed out everything to all the specialties. But primary care, which is general medicine, pediatrics, family medicine, those three specialties really have been shown to be the cornerstone of providing efficient, effective, and value-based care. And I think that's very true, actually. So, because you end up being, as a family doc, you end up being, in many respects, a coordinator of care, particularly for patients who have complex care. And because you have that relationship with somebody, you'd be amazed what people come back to your office and ask you, is this okay with this cardiologist who's a specialist in heart disease? Is it okay what he said? And I said, like, yeah, it's okay.
I had a client who, she was the head of a hospital. Her husband was a gynecologist.
Uh-huh.
And she was paying his insurance, which was about $500,000 a year.
Ooh.
And she finally was fed up with it. And she told him, you need to stop delivering babies. And he was a really good doctor. The problem was, because of all the malpractice and so forth, this is why she was paying $500,000 for his insurance. He could barely afford it, but he said, I love delivering babies. She goes, why don't you go become a plastic surgeon or something else? Because she goes, I am done paying your insurance for you. And, you know, as the head of the hospital, she was dealing with everything. And, you know, as my client, she told me this. And I said, well, has he ever had any malpractice? She goes, never. He's a phenomenal doctor, great gynecologist. But because there's been so many malpractice lawsuits, he's paying the dues.
Yeah.
Actually, she's the one paying the dues.
She's the one paying the dues, right? That's true. Yeah.
So there are a lot of malpractice. Listen, I currently have another client who is having reconstruction surgery because the first surgeon did not do it correctly. And there's proof that he didn't do it correctly. And that's an easy amount because there's proof of it. So she's been going to doctor to doctor to see if they'll fix it. And so many doctors didn't want to touch it because they didn't want to be sued. So she actually had to go ahead and put something out there and say, I will not sue you if you fix it. If you fix the problem I have, right?
Right.
So, because a lot of people, the first thing in their mind is sue, 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 sue. And I always say, who is Sue anyway? Right? So is it scary for somebody to get into medicine because they have to have that in the back of their mind?
Well, maybe it is for certain individuals. It wasn't for me. I mean, I felt that if I did a really good job and really paid attention to the details of what I was responsible for, that and I had a good relationship with the patients, that it would all, you know, work out. And as I look back on my career, I can't really point to any particular problems that I had, you know. So for me, I would say no, it wasn't a big factor.
Gotcha. Thank you for saying that. Because you said when you pay attention to what you're supposed to do, and you did it, right?
Yeah.
So let's go ahead and talk about the healthcare systems, right? Because you have helped with the policy and even the international healthcare systems. Talk to us about that, and then I want to get into what telehealth. I think that's become a great and phenomenal thing, because if you're feeling sick, and then you go into the office, I always think that if I walk into an office and there's a bunch of sick people in the waiting room, I'm going to get sick too, right? So I think that telehealth is a great thing, because you can say, these are my symptoms. The doctor can kind of look at you, open your tongue, show me your tongue, all these things. So talk to us first about what you've done internationally.
Internationally, was involved. I worked for Ross Perot. He started a company after he sold electronic data systems. He started a company called Perot Systems. And Perot, over the course of the development of that company, really focused on a couple of areas, but one of them was in healthcare. And specifically, what they did is they basically outsourced, if you will, the information technology component of large healthcare systems. But they did it in such a way that literally most of the people that both worked in the organization, but also those that came to the organization, didn't know that Perot was there, because our intent was it wasn't about Perot. It was about really making sure that the system that was delivering the care was getting the right kind of support and infrastructure, et cetera. So at one point, just before I left, we were outsourcing 15 of the 20 largest healthcare systems in the country. And nobody really knew it, because that wasn't our goal, is to have us be known for that purpose. And at one point, I helped start the consulting practice. So I basically, we did a lot of consulting around how to deploy these systems, which things should you be considering, et cetera, et cetera. So we did all that kind of work. And after doing that for a number of years, Mr. Perot asked me to move to London and to take over responsibility for international. So I lived in London. Actually, I had a house in London. I didn't really live there because I lived on the airlines.
Yeah, right.
I was on the road 6 days out of 7 most times, and flew all over. I took us into India, China, the Middle East, and parts of the EU. And it was a great experience. I mean, I really learned a lot. Matter of fact, so I did that for 3 years, and Mr. Perot came over and said that Barack Obama had been elected president, and he was convinced that that was going to be a big deal for healthcare, and it was, in retrospect. And so he wanted to establish a Washington, D.C. office, and he wanted me to come back home and run it and to be there. And so he was lobbying me to, leave London. And I said, gee, I think this is really important, but I really like living here, and I am enjoying my work on the international. And he said, yeah, but this is really, really important. And I said, yeah, I understand, but we got lots of people in the organization. I'm sure we can find somebody to do that. And he looked at me and he said, son, you don't understand. You're moving to Washington. I said, oh, yes, sir. Yes, sir.
Yes, sir.
So I moved to Washington. And the rest is history. So,
yeah. Well, tell us about that history of you moving to Washington and operating there.
Well, I was involved in various issues, policy issues related to support of information technology that were important to Perot. I ended up actually becoming Joe Biden's health policy advisor for his first presidential campaign in 1987. And that was when AIDS was a big issue, and a couple of other problems were sort of rearing their heads. And so I was involved in sort of reaching out into the healthcare community to identify individuals who were supportive of, the positions that he was taking, and mobilizing those people to create sort of a healthcare momentum, if you will, for his campaign. So that I did that for part of the campaign, and then he dropped out.
Right.
So,
like you said, it is history.
Yeah, it is. But you learn a lot. Matter of fact, I just recently discovered, actually in a box here at home, I found my briefing book for President or Vice President Biden at that point. And I was thinking I should send it to their library, you know. You never know.
You never know. That's right. So, where have you been after Washington?
Well, after Washington, then I really started my own kind of efforts. And I've been working on a number, I've done consulting, individual consulting for organizations and individuals. And got involved in writing some books and that kind of a thing. I also more recently have developed some projects. So, for example, there's two of them I think are pretty important. One is one of the issues we face in the healthcare community is that when patients are discharged from the hospital, the readmission rate ranges anywhere from 12 to 15%. Well, that 12 to 15% costs billions of dollars, you know, because people come back into the hospital. And when you look at the why, it's really not rocket science. I mean, a lot of times it's just very simple kinds of stuff. But they come into the emergency room and they get readmitted. So I developed a company that has basically taken on the responsibility for managing patients once they're discharged from the hospital. We have a virtual medical assistant who's assigned to every patient who gets discharged, but the virtual assistant lives in the geographic area where the patient is located, so they know local resources. They know the local nursing community. They know the local pharmacists. They know the Uber drivers, you know, et cetera, et cetera. And as a result, you know, patients can get a ride to the doctor's office. They can get their medications. They can, you know, get their food provided to them, et cetera. And the medical assistant is responsible for making that happen. As a result, we have reduced the readmission rate from, for our particular client, our alpha, and we've done it over 2 years now. It's consistent, 12.7% to 2.5.
Oh my goodness!
Literally, if you apply that to Medicare, Medicaid, that's billions and billions of dollars of savings that would be occurring. So that's one of my projects. The other one is I'm really convinced that medical and health science students are not getting appropriate education on the use of information technologies, digital health. And so I've been working on creating a core curriculum that could be used in medical schools to educate the clinicians, both health sciences and medical, with a core curriculum, much like you get a core curriculum in anatomy, physiology, microbiology, etc., all your ologies. You need one in digital health. And so I've been working on that. Actually, we have a couple of universities that are participating in that. So
I love the fact of getting a VA who is local to the patient, because like you said, it really does reduce, because they don't have to guess what's going on. They know the community. That's important. Let me share one quick video with you, and then we'll come right back.
Yeah.
You've followed the rules, tried the restrictions, counted the carbs, the steps, and the failures. You're not lazy, you're exhausted from doing it all without real change. What if the problem isn't you, but the plan? Sifu's Mind-Body Method is a 90-day transformation built on 7 unshakable pillars: mindset, movement, nutrition, hydration, fasting, journaling, and faith. This isn't another shortcut. It's your structure, your strength, your reset. You don't need harder, you need better. Ready to begin? Start today.
I'm just curious, what's your take on that?
I love it. I love it. That's great. As a matter of fact, it's interesting. That is a framework that could be integrated, if you will, with the framework that I put together on persistence.
That's why you and I have to work together. I want to talk about your book, right? It's in case you've seen it backwards, it's called The Persistence Factor, right?
Yeah.
You wrote this book, and it's the gap between a daring idea and a world-changing legacy, right? What made you decide that this? And thank you so much. This is a great book. Everybody, make sure you get yourself a copy of this book, right? The Persistence Factor. What made you decide that this is the book you needed to write?
Well, how it came about is I've written two other books. One related to healthcare called The Turnaround Imperative. And then the other one was about leadership called Toto's Reflections, the leadership lessons from the Wizard of Oz, because I really felt that the story of Oz was really had lots of lessons about leadership. But as I thought about change, one of the things that frustrated me, because I read all these books. I mean, literally, I wish you could see. Well, you can sort of see my pile of books behind me.
Oh yeah, I know you have a lot of books.
I got a lot of books. Those are the ones that still need to be read. But anyway,
You're like me. I love it.
And I was reading all these books on persistence and change and whatnot. But one of the things that frustrated me, Sifu, was the fact that there wasn't a framework. There wasn't a model for how you could go about really supporting change. And so as I thought about this, and I thought about my experiences of change, which have not always resulted in success. There have been failures as well. I then said, well, gee, it seems to me that there are certain elements that are really critical that are part of this change framework. So what are they? And I thought about it, and I thought about it. It took me 4 years to get this book put together. But, one is that you really need to be clear about what your purpose is. You as an individual, what is your purpose? Because if you're trying to accomplish change in areas that are not your purpose, you're going to have a difficult time. But you can always get up to speed, but you need to define your purpose. Second thing you need to do is you need to consider what are the resources and capabilities that you're going to need to accomplish the purpose that you've established for yourself. So you need to consider those. Then you need to commit not only yourself, but you need to most likely commit and gain the commitment of others who can work with you to help solve that problem. Because at least in my experience, big issues that need resolution aren't usually solved by one person going at it alone. They are solved with a group of people who come together and say, we're going to make this work. And then finally, you need to focus their time and energy. And that means you need to be clear about what are the steps that need to occur. How do we want to go about this? You need to constantly be vigilant about that whole process. Then you need to assess the results and say, what did we learn from what we've been working on? And then finally integrate your lessons, both successes and failures. Integrate your successes and failures, and that brings you back to purpose. And it's a continuous cycle. And if you engage in a continuous cycle along the lines of what I just outlined, your ability to persist is really enhanced quite dramatically. And as I looked back on all the things that I had done over the years, these elements were the constant themes that were evident. And it came to me, and I went, nobody's put this together. So I decided to write a book and put it together. That's what the persistence factor is basically all about.
I love it. If you think about persistence, I love the fact that children are so persistent,
Oh, yeah.
but we take it out of them, don't we?
Mm. Yes. Many times we do.
Yeah, many times we do. Not for you and me. We're still persistent.
That's right. That's right. That's right.
So Matilda wants to know where we're coming from. So Matilda wants to know where you're both speaking from. So I am out of New York in Long Island, Farmingdale. And how about you, Doctor?
I'm from Kittery, Maine, which is on the border of New Hampshire, the lower part of Maine. A lot of people in Maine really don't view us as Mainers, but we are. So.
You were telling me earlier about the rise and fall of the water. Tell us about that. That you can see it from the window.
Yeah, I'm looking out the window here, and we're at low tide for sure. And where I live on a bay that's just off of the Atlantic Ocean, and on the bay we have 10-foot tides, so it goes up and down 10 feet twice a day. It's really quite amazing, and
That
it's
is pretty
very,
amazing.
I have to say, it's very contemplative. Matter of fact, my very favorite spot is we have a sunroom, and I like to sit in the sunroom and watch the tide go up and down.
That's pretty incredible. Pretty
Yeah.
incredible.
I'm very lucky, very lucky.
Lucky by choice, I say.
Yeah.
Right. And I think that what you're doing in the world is an incredible thing. So thank you for doing so, and for persistently continuing to help people in everything that you do. So let's dive into the telehealth. How important is that nowadays, right? Like I said, I rather be in front of a computer and talk to my doctor than have to go and sit with a bunch of other sick people. But I really don't go to the doctor that much. I only go for my physical once a year because I keep myself fit through my program, right? Through Sifu's Mind Body Method. So talk to us about how important that telehealth is.
Well, I think that telehealth is very important in that it is going to offer us more efficiency, if you will, and more ability to assist patients real time on the problems that they're facing. I know for myself, just I'm going through this myself, where it's difficult to get an appointment. And so I've had a number of actually telehealth experiences over the last 6 months with my physicians. Now, at the same time, first of all, I would say, Sifu, that telehealth is what I would characterize as one component of digital health. So digital health is much broader, and I think needs to be thought of as a part of the healthcare delivery process. And the reason I mention that is that, for example, more than 70% of the people, before they go see their physician, go on to ChatGPT or whatever other system that they want to ask questions about their problem so that they have a better understanding and framework of the issue that they're facing as they go in to see their doctor. And the fact that 70% now are doing that's a pretty impressive statistic. It's really quite important. So I do think that telehealth is becoming important. At the same time, as we said earlier, there's nothing like the touch of another individual that can help you address a problem. Particularly with problems that are emotive or emotional in nature, or relationship oriented, or pick your favorite area. It seems to me that there's still a need for having that face-to-face relationship, but the convenience, if you will, of telehealth is really important. Now, that saying that, the other thing that we need to do in the United States is we have a very disparate access to telehealth. Those of us who live in the city don't have a problem. We have access. But if you're in rural North Dakota, where I grew up in western North Dakota, and you live on a farm, you might not have very good service. Or if you live in rural Maine up north next to Canada, you might not have very good service. That's a real issue. And so we need to really work on having ubiquitous capability, because it's not just me having a relationship with a physician. It's also the ability to manage other kinds of problems, because healthcare doesn't always occur in the clinical exam room. It also occurs at home.
Right. Absolutely. Interesting that you bring up the fact that there's so many different aspects to healthcare. When we really look at it, right? Sometimes it started with your grandma's recipe, right? Grandma said, take this when you have, this cold or whatnot.
That's right.
And but if you think about it, it's and a lot of those remedies really did work. So when we think about healthcare, it's a big concern, because here's a question for Matilda as well. How's the price of healthcare over there? In Australia, it's difficult to get a long enough appointment. And I agree with that, because I've been to doctors where they come in 30 seconds. I'm like, where did they go? They're gone. Because they're seeing a patient after another patient after another patient, and they don't even get to talk to you. So I found a practitioner that I go, and I said I get a medical once a year just to make sure I'm still healthy, my sugars are good, everything is good, right? Because I'm doing the healthcare for myself, right? That's why I work out, I eat right, I do all the good things for myself. But when I go see her, she spends a long time with me. And I've seen other doctors who, maybe I went for a health check, they're like, oh, you're good, and they're out. She doesn't. She stays there. She talks to me. She talks to me about my last visit. She gets into it, right? And I think one of the reasons is, I'm going to be super honest with you, she's also fit. I think that makes a difference, because if I want to learn juggling, I don't go to somebody who doesn't know how to juggle. If I want to learn how to bake a cake, I want to learn from somebody who's already baked hundreds of cakes, not somebody who baked the first cake yesterday. So for a doctor, I believe if they can't talk to me about food, if they can't talk to me about being healthy or movement, are they the right person? Because they're not preaching from experience.
Yeah.
That's just a question. And I see you're very fit as well.
Well, I try. I think that what you're describing is the need for access to primary care providers who are generalists, who have that sort of foundation, if you will, of understanding in a broad sense on sort of the major issues that affect people's health. That's one component that I think is important. You're also raising, though, another important, that's sort of the hidden side, if you will, and that is, at least in the United States, we have a fee-for-service system. Now, what you just described is a concierge practice, which is where you pay a flat fee and you have somebody that you can call up, and they see you and they know you and they take care of you. That doesn't exist in the regular reimbursement model for healthcare. And I think that's one of the issues actually that we're facing in this country. At the same time, if you take the UK, for example, or Matilda, Australia, there's a real lack of primary care providers because most of the physicians end up in the specialties. And as a result, there's no generalists that are available, even though it's a structured kind of a fee structure type program, and people always have access. I'll never forget the time I was in Ireland and I passed a kidney stone. This is 25 years ago. And I was worried about what the fee was going to be, and it was $20. It's like, what? It blew me away. But,
Right.
That's because that's the way their system was structured. And I think that's really coming to the forefront in the United States. It's going to be a big issue for us. Healthcare, when you look at the polls now, I just read a poll yesterday. 59% of the American public feels that healthcare is the number one issue. 59%. That's very significant.
It is. You were talking about ChatGPT before. I have an autistic client who happens to be 25. That's his age, not the way he acts sometimes.
Yeah.
Sometimes he comes in like a 2-year-old and has a temper tantrum. Other times he comes in like a 14, 15-year-old. And this poor kid will never, ever, ever, ever be able to live on his own.
Yeah.
But he complains that everybody's on his case. So he complains about his mother, she's a saint. But so one day he's on his phone and I'm like, what are you looking at? And he goes, oh, nothing. I said, what's nothing? He goes, well, I was getting advice about my mood. I was like, from who? He goes, ChatGPT. I'm like, you're getting advice on your mood, how you feel from ChatGPT? He goes, yeah, it talks back to me. I said, oh my gosh. I said, that's a scary thing.
Yeah.
Because this is a young man who's 25 years old. He's not 25 really. He's autistic. So mentally, sometimes he's 2, and sometimes he's 5, sometimes he's 12. And so what is it going to help him, or is it going to hurt him along the way? And I was concerned. Right? Do I have a right to be concerned?
Yeah, I think so. I mean, I think that if we don't
Monitor it, right?
monitor, manage is the word I was thinking. Manage these kinds of technologies effectively, we can get some adverse results. And we don't know that they're necessarily listening. I had a similar experience the other day where I went on ChatGPT to ask a question, and the answer came back, recently you asked a similar question. Would you like some additional information? I was like, oh, really? You remember me? It's like, oh, dear. So, yes, I do think that this is, it's a broader question that we as a society really haven't effectively dealt with. And I think it's going to be interesting because this technology is becoming integrated with our lives. And
It sure is.
we don't recognize it.
With all technology, if we don't know how to use it right, it can be harmful.
Absolutely.
But when we use it correctly, it could be phenomenal.
Right. Yeah. Exactly.
Well, Dr. Kevin, I got to tell you, always fascinating to have you on. I'm excited for what we're building together. And I know that you and I are going to do so many different things together. And I would love to have a conversation with you at one point, how a Sifu's Mind Body method and your program can integrate somehow.
Oh, yeah.
I would love to do that. But before that, I'd love for everyone to connect with you. So your website is going across the bottom. Tell us what somebody can expect when they go to your website and they can interact with you.
Well, CREO, what that means is creative. So Creative Strategic Solutions is the organization that I created as part of my consulting practice a number of years ago, probably 15 years ago. And basically what the website does is it explains the kind of work that I have done within the healthcare community, but also more broadly. And, I put various things that I have done or accomplished, white papers. I do a bi-monthly blog called the Fickenscher Files. And if you put your email on the website, I pick it up and you can get my blog. And the blog, basically, I talk about a whole variety of issues, all the way from politics to healthcare to societal trends to, gee, I didn't know this. And it's, people say it's very interesting. So,
yeah. Matilda, you were not very chatty. You were perfect. So thank you for being here. And she is going to pick up your 3 books. So yes, Matilda, I got to tell you, you're going to enjoy definitely this one. Tell us the name of your other 2 books.
The first one is called The Turnaround Imperative. It's about how healthcare needs to move in a new direction. And the other one is about Toto's Reflections, the leadership lessons from the Wizard of Oz. And basically my message there is that Toto was the one character that everybody listened to. And, when Toto spoke, everybody stopped and everybody listened. And
That's it. I love it. Also, by the way, anybody listening, look out for it. It's coming August 21st. We're going to have a summit from 8:30 to 3 p.m. And that's going to be on Friday, August 21st. And it's going to be a leadership summit. So we will put out stuff out there. It's coming, just letting you know. Dr. Kevin is going to be with us as well. And it's going to be a phenomenal, phenomenal time. We're going to bring you incredible experts. Everybody have yourself an exceptional day. Do me a favor. Somebody needed to listen to this conversation today. Dr. Kevin, you are just a gift, my friend. You are. Thank you.
Thank you. Thank you.
All right. God bless everybody. Take care.
Take care.